Number one, if your liver enzymes are elevated but equally, modestly, and you had a workout before that, do a retest. It's probably normal and reasonable because your muscles got banged up during the exercise. If your creatinine is higher, but it's because you've been on creatine for more than a couple months, ask them to do a cystatin C or just do a little mental fudge factor here, subtracting out 0.2 from your creatinine level and seeing if that actually is a meaningful issue with your EGFR afterwards. Cholesterol. Remember, ApoB is one of the most important things I look for. I basically had a cholesterol panel. My eyes go to two things: triglycerides, ApoB. If trigs are low, ApoB is low. I don't care what the rest of it says, really. Yes, there's some more nuance to it than that, but in general, if you've got fairly high HDLC, typically protective, not always, typically a good thing, low ApoB, low triglycerides, we'll move on to a different part of the conversation. However, if your doctor's only running an LDLC, or the panel doesn't include ApoB, and they're again marking you down with hyperlipidemia and overweight and elevated creatinine, you're going to get dinged on your insurance for something that is actually a reflection of good health. High estrogen, not a problem. Does a lot of good things, as long as it's reasonable and proportionate to your testosterone levels. So when you have high free testosterone, you'd expect a high estradiol. If you're not having symptoms of nipple tenderness, sensitivity, breast development, emotional lability, those kinds of things, probably not an issue. Do not let someone give you an aromatase inhibitor. All you're going to do is gain weight, feel crappy, hot flashes. You're going to go through menopause if you take one of these just to treat a number. Finally, BMI. Remember, lower BMIs, not always better. Higher BMIs obviously need to be in certain situations. But if your BMI is upper 20s, low body fat, clearly it's not a problem. Use waist circumference to quickly elucidate where it's relevant and where it's not.